Hi, friends. Welcome to Yoga for Dentists. I'm Dr. Josie DeVidio, longtime dentist, registered yoga teacher, and certified wellness consultant. Today, I'm chatting with Dr. Nardine Bekhit, who is a chiropractor in Ottawa, Canada. And she is a wealth of knowledge, and I wanted to invite her to have a conversation about how dental professionals, specifically dentists, because I am one, but I'm sure this applies to anybody working in dentistry, how to pick a chiropractor, right? But there are certain considerations that we need to talk about before we get to that particular point. So join me in welcoming Dr. Bekhit to the show. Welcome, Nardine.
Thank you, Dr. DeVidio, for the introduction. I'm really excited to be here.
So tell me a little bit about your journey to become a chiropractor. Like, did you wake up, when you were a little girl and say, I'm going to be a chiropractor someday? What was that like?
I like to say I didn't choose chiropractic. Chiropractic chose me. A lot of us who find ourselves on this path tend to have a story. Most of my colleagues, they have an experience with a chiropractor where they were in a car accident or sports injury that didn't respond to anything else but chiropractic care. My story is a little bit different in the sense that I did stumble upon it quite by accident. But I think that my upbringing, being exposed to healthcare professionals, both my parents working in healthcare, I had always had the desire of choosing a career in healthcare, but I was also very predisposed to always wanting to have more like a wellness approach with things with my own health. Wanting to be more proactive, looking at lifestyle as opposed to jumping to medication as a first resort. So I think all of that led to just me being perfectly primed for choosing a career in chiropractic. So when I stumbled upon it, I went down the rabbit hole of like Google and then started shadowing. And I thought, this is a great fit for me in terms of how I see myself as helping patients, as well as the kind of lifestyle that I want, and aligned well with my healthcare philosophy in that encouraging people to live healthy, active lifestyles, taking time with patients, being a health coach for patients, being a good resource for them for health information, and just having the flexibility to take my career in any direction that I wanted. And I think the influence of my upbringing too. So my mom is a dental assistant, and so dentistry has always been a part of my life. And I've always had an affinity for the dental profession. And she works at a very large orthodontic office, this open concept. And I remember being in that office while I was in chiropractic school. So I was getting Invisalign treatment there and just looking around the room and seeing all the hygienists hunched over their patients. And it was kind of like an epiphany moment for me right then and there that as chiropractors and, even physiotherapists and other people in the musculoskeletal field, we receive so much education on how to help people who work in office settings, corporate ergonomics, but very little is said about, well, what about profession-specific ergonomics? Because there's different demands there, different needs for sure, different pace of work. And so it's really important to help these people because especially because these are healthcare providers and, we need to care for the caregivers so that they can continue to do the important work that they do without sacrificing their own health in the process. And so realizing that, no one's really speaking to this niche, then I made the resolve at that point that I wanted to dedicate my career to this field. And so that's what I did. I really am just somebody who took a lot of time to consume a lot of research about, what best practices are in ergonomics in the dental world, and just filtering all that information through the lens of what I know as a biomechanical expert, what I've seen with patients, because there is a lot of information out there if you seek it.
Right.
Some of it is confusing, contradictory. The information we know now it changes as we evolve and we learn more and we know to do better. What we might have learned in an ergonomics class in school can be very different from what I might come into your office and teach you about today. My content has evolved too, with the doing this for several years now. I've learned more and I've adapted and evolved with that knowledge as well. So that's what I hope to offer the dental profession, just making it easy to understand, making it seem less of a daunting task, just kind of fun a little bit too. It doesn't have to be dry and boring, and just a lot of myth busting too in terms of what we talked about. So
Yeah. And so let's talk about myth busting for a second, because Dentists tend to consider themselves scientific. There are scientists, deep down inside that became dentists, basically, tooth doctors. I was trying to, say something, but I'm sure someone will get annoyed that I said that, but that's the truth. We're basically people who are interested in biological sciences and how to apply that to a very specific area of the human body. Sort of like chiropractic, right? You're scientists who tend to dedicate your field of study to a very specific part of the body, the spine, and how the spine dictates movement and all of the other things. So I always think it's funny when some, let's say, traditional healthcare practitioners are freaked out by what's considered maybe a more alternative medicine type of practitioner, right? And I think some people here in the US anyway put chiropractors in that boat. And it's really unfortunate because chiropractors, this is purely my opinion, are very similar to dentists in that there are excellent ones and there are wacky ones. And neither profession should be, we shouldn't throw the baby out with the bathwater just because of a few people who don't know what they're doing. It's the same in dentistry. And so I want to share an example of something that happened to me about, let's say, almost 2 years ago now. Well, it really happened to my son. I've been going to chiropractors for a long time, and I've had a variety of chiropractors for different things that I needed in my body. But that's a story for another time. But I was familiar with chiropractors, and my son, who was heading off to college, decided one day to ride our spin bike and to do it at like the hardest level possible. I don't know why he did that. He's, prefrontal cortex not fully formed kind of exercise. So later on that evening, he ended up like succumbing to a lot of pain. Like he couldn't move. He passed out from the pain. It was really bad. To the point, and he's 6 feet tall. Like I'm 5'2" on a good hair day. He's 6 feet tall. He passed out. I couldn't like lift him or help him or anything, right? I did what I knew to do, lift up the feet, bring him back to life. But he was in so much pain. He was throwing up. I had to call an ambulance to bring him to the hospital. We don't know what's wrong. Like at the time, we didn't correlate this to the crazy bike riding. It was just like all of a sudden he was in pain. Went to the ER, and this was during COVID. And he was technically 18, an adult at the time. So I was not allowed to go in with him. So I'm sitting like out in the parking lot, cell phone communicating with him. And long story short, maybe it's too late now, but they couldn't figure out what was wrong with him. But he was in so much pain. He was writhing and like freaking out, about to throw up again. And so they just put an IV in and kept pumping him full of morphine. And, they do x-rays, they do all of the tests, they can't figure it out. We don't know what's wrong with him. And I'm like, my God, he's about to die. Like as a mom, it's terrible to watch your son in that much pain. It's awful. And finally, because the ER doctor, we were going back and forth on my cell phone, he finally gave me permission to go into the ER to be with my son. And I'm having this conversation with the doctor, and I'm like, so what tests have you done? And he tells me, so you're finding nothing. No, nothing's wrong. And so then I'm like, okay, maybe it's related to the bike ride, right? Because at the time I didn't realize, that he did this heavy ride. I just knew he was riding a bike. And so I asked the doctor, I'm like, okay, well then just release him to me and I'm going to take him to my chiropractor. And he, the ER doctor's like, I wouldn't recommend that because he's in so much pain. You don't know what's going on. You don't want the chiropractor to like mess something up. And I'm like, that's fine, but you can't figure it out. I can't have you keep pumping him full of morphine. Like we got to figure something out. So just release him to me. And my son and I had been sort of having this conversation on the cell phones of like, if they can't figure this out, I'm going to call the chiropractor and we'll go see my chiropractor. And so my son told me that when he went to get an x-ray done, the x-ray tech was talking about, what'd you do? Trying to figure it out. And my son mentioned like, yeah, if you guys can't figure it out, we might go to the chiropractor. And the x-ray tech was like, oh, I wouldn't do that. Like everyone was poo-pooing this whole chiropractor idea. I convinced the ER doctor to release my son, against medical advice so I could take him. And we went directly to my chiropractor, who was amazing and met us at his office because, this is happening, not during office hours, of course, and adjusted him. And he was like 85% better. Right. So now we had been at the ER for like hours, like 10 hours. My son's getting pumped full of morphine because they don't know what's wrong. And mind you, the morphine was not helping. The morphine was not helping. He was still in excruciating pain. So we went to the chiropractor. Chiropractor, did his evaluation, adjusted him. He was 85% better. And then we had to go every couple of days to, resolve the issue. Ultimately, what was happening is he was having a spasming psoas muscle, which is very deep in the body, close to the spine. And, basically it was wreaking havoc. And that was the result of the very heavy bike riding, right? So we started to work backwards and figure out that's what happened. So why would medical professionals be so resistant? Like, if you can't figure it out, why not go, okay, well, maybe someone else can figure it out. Let's get another set of eyes on this. Why is there, in your opinion, such a disconnect for people between, what I would consider, let's say, alternative styles of care versus more Western styles of care? What's your opinion on that?
It's like you mentioned earlier, we're a profession that is, if there's one bad apple, we're all, it's not just one bad doctor, it's the whole profession is bad. But thankfully, I've been noticing that story has been changing in recent years. Certainly when I was going into school, people were like, are you sure you want to do this? And I was very aware of the stigma and the lack of acceptance in mainstream medicine. But as we evolve, as we grow as a profession, we are a relatively new profession as far as, professions in healthcare go. And as more research comes out, as we're able to validate what it is that we do and why, because for a long time we knew things work, but we didn't really know, we didn't have the research to back it up and explain why. And that's obviously really important. So as that's developed, it's becoming more and more mainstream. And, there are guidelines that are coming out now that are recommending conservative care, AKA chiropractic care, physiotherapy as a first line defense for mechanical issues. So the story is changing, thankfully. There will be people who have their own preconceived ideas because either they have had maybe a bad experience or preconceived notions, or, pop culture doesn't always paint us in a favorable light either. And I think that the best way to truly understand what it is that we do as chiropractors is to see one yourself, because it is a little bit hard to explain. You really truly have to experience it yourself and, realize that we're not just going around cracking people's backs, left, right, and center. There is a process in terms of, screening patients, making sure that we've done a thorough health history, physical exam, we can come up with a diagnosis. And then from there, determine what the best course of action is. And it doesn't always involve spinal manipulation. Part of the process too is triaging, like making sure this is someone who is appropriate to be under chiropractic care, or do they need further medical investigation to see what's going on. And that the different styles of treatment, there's a variety of different ways we can help people. Sometimes it's soft tissue therapy, sometimes it's exercise, ergonomic advice, sometimes it is the spinal manipulation. And even within that category, there's so much variety. There's low force techniques, instrument assisted. There's the manual where you do typically hear the audible like cracking sound. But a good chiropractor will cater towards the person that's in front of them. So for example, in my practice, one of the important questions that I ask is, what are you looking for? What does the patient want? And one of my goals is to kind of figure out where they are, like what they're really looking for, because I have a wide spectrum of people that come to me. I have people who come in who say, I watch TikTok videos and I just want you to crack me like a glow stick, like they do on TikTok. And other people are like,
which feels really good, by the way. I like that. But go ahead.
Yeah, but it's not for everyone, because on the other side of the spectrum, I have people who are like, I'm actually really nervous sitting here because I don't want you to crack me. And I'm like, okay, if you don't want me to crack you, which I don't like using that terminology, but that is what people are saying, then that's fine. We can find other very effective ways to do what we need to do in a way that makes you comfortable.
Right. Well, so let me bring something up that I hear a lot. So when I work with clients, I run a signature program for lady dentists, and I'm hear a lot of body mechanic issues through them, but I also work with people outside of my program. And the common theme that seems to happen, right? Like we as dentists already kind of assume low back problems or neck problems or whatever. But one thing that's really funny to me is everybody feels like they have carpal tunnel syndrome or sciatica,
Mhm.
right? Because depending on what part of the body, and so those are like sort of the things they can identify, and they automatically assume that they're going to need surgery. And so I'm
Mhm.
always like, well, okay, hold on, like it's kind of in dentistry, it's the equivalent of my tooth hurts. Let's pull it out and put an implant in. Okay, well, hold on. Let's investigate further. And so, what I often do is guide these people because it's probably not carpal tunnel and it's probably not sciatica. It's just something that they've heard of, they sort of understand. And so they just label their pain that. And so, what I say oftentimes is before you commit to having any kind of surgery, why don't you see a chiropractor first and have these things evaluated and see what they say. But like you said, there are many kinds of techniques in chiropractic, and some chiropractors are just like dentists, more skilled than others and understand the different therapeutic approaches differently. And so when we refer people, or when I refer people to the chiropractor, I often don't know specifically what to tell them to ask or look for
Mhm.
because, like I said, I've gone to several chiropractors over the years and they've all done different things. And I've left them, quote unquote, not because I didn't like them or they made me mad or whatever. It's just because I was looking for something else in terms of my care. So, what kind of recommendation would you give to someone who's listening to this episode who is likely a dentist or a hygienist or somehow involved in the dental field if they're considering seeing a chiropractor to address some musculoskeletal issues? By the way, I know we say that differently than you do in Canada, but and there'll be an arm wrestling point at the end of the show to figure out which one's right. No, I'm kidding. Um, but so someone who's considering seeing a chiropractor, what do they need to look for or ask about, right, as they're vetting
Mhm.
chiropractors?
Yeah, I love that because a lot of people just kind of like it almost seems like they're just like shooting a dart and just like seeing like, well, who's near me and I'm just going to go to them, and then it's not always the right fit. So I would start with first doing some reflection yourself about what it is that you're looking for in terms of what are your goals? What do you want to get out of this? Do you want to just patch up the problem and that's it? Are you looking for something a little bit more like a long-term relationship where you might be undergoing maintenance care, like something that's a little bit more of a proactive, preventative approach? What kind of time commitment are you looking for? Are you looking for short appointments, longer appointments? So yeah, so just like all those like kind of lifestyle questions, what it is that you want specifically, because it varies from person to person. And the diversity in the chiropractic profession, it can be good and bad. It's bad in the sense that like it makes it very confusing for the public, like to really be able to figure out like who do I see, how do I know, and all that. But it's good in the sense that because there's a diversity, we can cater to a diverse population, and there's probably going to be a type of chiropractor for every person's type of goals and what they're looking for. Yeah, so like it varies. You could be looking at very short appointments. You could be looking at longer appointments where the chiropractor spending more time, one-on-one, maybe going over exercises, giving you a more structured exercise program to do at home to support care and all of that. I would look for, think about, what is your comfort level with manual therapy? Like, what are you looking for to get done? Like, are you looking for, you just want soft tissue therapy? Are you looking for, the crack me like a glow stick type of situation? Are you looking for someone who does low force techniques? And then from there, I would start with, asking friends and family for their like personal experience, like and ask those questions, like what were your appointments like? Were you happy? Did you get the results you were looking for? Then looking at websites and reviews, seeing what patients are saying. From the website, you can often tell what kind of style of chiropractor they are and how their like the patient experience is going to look like. Even call the clinic, ask them, questions like, how long are appointments? What modalities does the doctor use, if at all? And like, what can I expect? Or, questions like that can maybe help you see if you're aligned with that provider. Checking them out on social media. A lot of chiropractors are turning to Instagram to help, put themselves out there and attract their ideal patient. So you can kind of get a sense of what they're like and what their philosophy is from that standpoint. And if ultimately, it doesn't turn out to be what you wanted, then keep trying, like chiropractor shop if you want to to figure out until you find the right person for you. But that would be my advice.
And those are good tips because, yeah, you try one chiropractor. Let's say you don't like the experience or you don't vibe with the personality, that doesn't mean give up on the whole thing. You can try another one, try a different person, until you find someone you work with. I mean, this is basically what we tell our patients to do in dentistry, right? I have a totally different style of practice than the dentist upstairs from me. And, one's not better than the other. It's just different. It's just a matter of what you like and are expecting and hoping for. And certainly you can ask questions. And I think it's accurate, like you said, that you can sort of see what they're all about on their website. But arguably, like you said, now on TikTok and Instagram, you really get more of a feel for someone's personality than just looking at their website, right? And reviews, of course, are always helpful. But let's take a step back because in dentistry, we often talk about prevention. And so let's talk to our audience about maybe what lifestyle factors or, are there predisposing factors that put dental professionals at a higher risk for needing a chiropractor? Like I said, obviously we all know in this field, our body's going to hurt in some way. And many people just accept that, which is sort of terrible, right? Because we can do things to prevent pain and to promote the longevity of a career in dentistry. So let's talk to the audience about any lifestyle factors or just general, predisposing factors that put people at risk.
So in terms of, predisposing factors, that could vary from anywhere between history of injuries to anatomical things, what kind of sports you play, all of that can play into your genetic makeup or, whatever that could make certain issues more prominent for you compared to others. In terms of when we talk about ergonomic risk factors, there's 5: sustained awkward postures, repetition, contact, stress, force, vibration. Those are the 5. And all 5 of those are present in dentistry. And add on top of that, mental stress. The very fast pace of work, it's a very stressful environment. So, your coping mechanism with stress, that could also predispose you to some things compared to others, because a lot of us carry stress and tension in our bodies. In terms of lifestyle, I think the key message is, it's like you said, pain is very common in the dental profession, but it doesn't mean we should just sign ourselves off to a lifetime of chronic pain. It's common, but it's not normal. And I do believe that there's a lot of things that you can do inside and outside the operatory to mitigate that, manage it, prevent it, etc. But the key message is that our bodies are resilient and adaptable to our day-to-day stress. We just have to do the right things. And by do the right things, that means moving as much as possible. Our bodies crave movement. We're dynamic beings. So having a well-rounded exercise routine that includes cardio, resistance training, mobility, and, breath work, stress management, all of that, that's all very important. And the biggest thing with this is choosing an exercise program, routine that you enjoy, because compliance is the most important thing, so that you have that consistency so that you can actually benefit. And then other factors in terms of spinal hygiene, such as investing in a good quality mattress and pillow, that goes a very long way, because when we're sleeping, that's when our body is healing from all of the stress of the day. And if you're not being supported in neutral posture while you're sleeping, then you're going to wake up stiff and sore, and you're kind of already starting your day with a setback. You should be waking up feeling refreshed and good. And if you're not, then, you probably need to look at your sleep posture, as well as, maybe there's your mattress or pillow aren't well suited to your body.
Yeah, that's something that people overlook.
Yeah, absolutely. To add to that, besides the physical part of sleep, there's a mental part of it too. And there's a really interesting study and this one was specifically for surgeons, that shows that when surgeons they have musculoskeletal pain, and it inevitably has an effect on their quality of sleep, then cognitively they aren't as sharp. And so they're more likely to make mistakes. And so all to say, dealing with pain, making sure you're sleeping well makes you a better clinician at the end of the day. So it's part of patient-centered care is taking good care of ourselves. So yeah, so I think like going into it with that mindset that, it's not just about my technical skills or like my patient management skills, but also how I take care of myself as a clinician, and thinking about ergonomics and exercise, to stop thinking about it as if it's something that's wasting time or makes you less efficient in the operatory. And instead thinking of it as this is going to improve the longevity of my career. It's going to make me more productive. It's going to make me, better able to care for my patients. I think that's one of the best places to start.
Yeah. It reminds me of when we tell our patients to floss. Most people will brush. I mean, they may not brush well, but most people will brush. But it's kind of like we say, hey, you should floss. And then there's this joke about you only have to floss the teeth you want to keep, right? And it's kind of like the same. It's like what I'm trying to tell people, in terms of body maintenance and this message that you're telling us too, is it's like, you have to look at your body and you have to take care of it. It's not a waste of time. Flossing is not a waste of time. We wouldn't recommend it unless it did something good. And you wouldn't recommend the tips that you're giving the audience if they weren't helpful, and you only have to move and take care of the body you want to keep, right? Especially in dentistry, if you're looking at the career in terms of long-term, right? Which especially nowadays with how much debt people are coming out of dental school with, they're looking at staying in the career for a long time. And so it's really important to take care of your body in such a way proactively now before it really starts to hurt, so that you can stay in that profession long term. But you know what? Something you said reminded me of something. So I'm gonna put you on the spot. So like when people go to sleep and they wake up with a kink in their neck and like they can't move their neck. What is that? Why does that happen? That's always been like this mystery to me. Like, why? What happened? I normally sleep in this bed with this pillow, and all of a sudden I have this kink in my neck. What's that all about?
Well, without doing a thorough history and physical exam, hard to say, hard to give a blanket answer. But typically in my practice, I see that it's usually a accumulation of stress. And it's usually a problem. Because it seems like it's something that you just woke up with one day and it just came out of nowhere. But typically it's preceded by reduced range of motion, flexibility. There was something brewing for a long time, and it was just, it finally decided to, manifest as pain. A lot of the times with MSK disorders, pain is the last symptom to appear. So there could be other signals that we're just not paying attention to, or that we dismiss as like, oh, whatever, like it doesn't really matter that I don't have full range of motion and being able to turn my head this way. I'm not going to do anything about it. So that's why I always love when patients come in for a posture check or a wellness check before they're symptomatic and in pain, because we can get ahead of these problems, take care of them before they manifest themselves as, pain problems or like, stuck in one position.
Yes.
Yeah.
Well, that's such a good point. And, again, we say this to our patients too. By the time the tooth hurts, right? Like sometimes we'll say to a patient, hey, you have a cavity, you should get it fixed, right? Paraphrasing. And they'll go, well, I can wait. It's not hurting me right now. Well, buddy, by the time that tooth hurts, it's a way bigger problem, right? Yeah. And so, the first signal is, oh, that felt weird when I ate that, or when I drank that didn't feel right, but it goes away. But that's the signal that something's brewing, right? And so that's the same with our body. That's one of the reasons I really love yoga, right? Because yoga, at least the way I teach it and practice it as a lady in her 50s, is a very slow paced way for me to really just learn to understand my body better and to hear my body better, so that it can whisper to me and I can hear it, as opposed to waiting until it's screaming at me to do something about it. And so that's a very good point that you made. By the time you're in pain, there have been so many things leading up to that. So really staying on top of your body musculoskeletally should be a preventative thing, and so in my opinion, most dental professionals should have a chiropractor as part of their personal healthcare team, because they look at things differently than a Western medicine physician would, even differently than a physical therapist would, and I'm a fan of physical therapy too. In fact, at one point in my career, when I was suffering more than I needed to, I would do both. I would have a chiropractor and a physical therapist because in my head it made sense to, have the chiropractor put everything back to where it was supposed to be, and then have between the two, the exercises to fortify, strengthen the system to stay put. So that's, that was my take on it and my experience. So if you're listening to this and you've never had an experience with a chiropractor, or you have had an experience with a physical therapist, they're both great. They just do different things and approach things differently. Sort of like in dentistry, we have, oral surgeons and periodontists, and they both place implants, but they both approach it maybe from a different physiological, but also treatment planning, or what their focus is. It's just different how they approach the treatment. So
Yep, exactly. We kind of do this, a lot of the same things, treat the same conditions. We might just approach it from a different perspective. And I love that. I love when my patients are doing both at the same time. Some people think that, oh, should I only do one? Is it going to undo the other? No, they complement each other really, really nicely.
yeah, absolutely. Well, Dr. Bekhit, it's been a pleasure to have you on the show. You are a wealth of knowledge. I enjoy your passion, not just for chiropractic, but how to apply chiropractic care in dentistry. I know that you have dentistry in your family. I know that your mom is a dental assistant in Canada. And so you bring an extra layer of attention and care to how you serve the dental industry through chiropractic care. So if my audience members want to learn more about you, or even just, sort of spy on your content a little bit, where can they find you online?
So I spend most of my time on Instagram. I'm at Curly Chiro, Chiro as in chiropractor, not Cairo as in Egypt.
Yeah.
People have gotten that mixed up in the past. And I do have some videos out there, exercise tutorials, chairside stretches, pre-post clinic warm-up, strengthening exercises for dentists. That you could check out. I'm always just a DM away if anyone has any questions. If anyone wants help vetting a chiropractor in their area, be happy to help you figure out, connect with someone who should be a good fit for you. Always happy to chat with anyone. So.
Awesome. Thank you so much for being on the show. And to my listeners or viewers, if you check the description of this video, if you check the show notes, I will have the links for you to connect with Dr. Nardine Bekhit, our guest today, who is a chiropractor in Ottawa, Canada. Thank you so much. Be well, friends.